Hello and welcome. Today, we're diving into a condition affecting the eyes called conjunctival nevus. It's a common, usually benign, growth on the conjunctiva, the clear membrane covering the white part of your eye. Join us as we explore what a conjunctival nevus is, what causes it, how it's diagnosed, and what treatment options are available. So, what causes a conjunctival nevus to form? The precise cause isn't always clear, but it's generally believed that they arise from a localized proliferation of melanocytes, the cells responsible for producing melanin, the pigment that gives color to our skin, hair, and eyes. These melanocytes clump together, forming a small, pigmented spot. Unlike some other eye conditions, conjunctival nevi are typically not associated with systemic diseases or underlying genetic conditions. Sun exposure, however, may play a role in their development and growth, similar to how sun exposure can affect moles on the skin. Now, let's talk about the underlying mechanisms. In essence, a conjunctival nevus is a benign tumor composed of melanocytes. These melanocytes originate from the neural crest during embryonic development and migrate to the conjunctiva. Normally, these cells are evenly distributed. However, in the case of a nevus, there's a localized increase in the number of melanocytes. These melanocytes can be found in various layers of the conjunctiva, including the epithelium and the substantia propria. The degree of pigmentation depends on the activity of the melanocytes and the amount of melanin they produce. While typically benign, there's a small risk of transformation into a malignant melanoma, which is why monitoring and occasional biopsy may be recommended. Conjunctival nevi are quite common, more so than you might think. They can occur in people of all ages, races, and genders. However, they're most often diagnosed in children and young adults, typically before the age of 20. While precise prevalence figures are difficult to obtain, studies suggest that a significant portion of the population has at least one conjunctival nevus. They are less common in older adults, as some nevi may regress over time. How would you know if you have a conjunctival nevus? The most common symptom is the presence of a pigmented spot or lesion on the conjunctiva. This spot can vary in size, shape, and color, ranging from light tan to dark brown. Some nevi may even be non-pigmented, appearing pink or flesh-colored. Often, they're located near the limbus, the border between the cornea and the sclera. Most conjunctival nevi are asymptomatic, meaning they don't cause any pain, irritation, or vision problems. However, some people may experience mild discomfort, especially if the nevus is raised or located in an area that rubs against the eyelid. In rare cases, they can cause a feeling of a foreign body in the eye or mild dryness. So, how are conjunctival nevi diagnosed? The diagnosis is usually made during a routine eye exam. Your eye doctor will carefully examine the conjunctiva using a slit lamp, a special microscope that provides a magnified view of the eye's structures. The doctor will assess the size, shape, color, and location of the lesion. They will also look for any signs of growth, changes in pigmentation, or other features that might suggest malignancy. In some cases, the doctor may take photographs to document the appearance of the nevus and monitor it for changes over time. If there's any suspicion of malignancy, a biopsy may be performed to obtain a tissue sample for microscopic examination. Conjunctival nevi can be broadly classified based on their location and characteristics. They can be junctional, meaning they're located at the junction between the epithelium and the substantia propria, compound, meaning they're found in both layers, or subepithelial, meaning they're located solely in the substantia propria. Furthermore, they may be cystic, meaning they contain small fluid-filled cysts. Some nevi may also have feeder vessels, small blood vessels that supply the nevus with nutrients. These classifications help the ophthalmologist to better understand the characteristics of the nevus and to assess the risk of malignancy. The treatment for conjunctival nevi depends on their size, location, symptoms, and the presence of any suspicious features. Most conjunctival nevi are benign and don't require any treatment. However, if the nevus is causing symptoms, such as irritation or discomfort, or if it's growing or changing in appearance, treatment may be considered. Options include surgical excision, where the nevus is surgically removed, cryotherapy, where the nevus is frozen and destroyed, or laser ablation, where a laser is used to remove the nevus. If there's any suspicion of malignancy, a complete surgical excision with wide margins is typically recommended. Following treatment, regular follow-up appointments are essential to monitor for any recurrence or signs of malignancy. While we can't completely prevent conjunctival nevi, there are steps we can take to reduce the risk. Protecting your eyes from excessive sun exposure is crucial. Wear sunglasses that block 100% of UVA rays when you're outdoors, especially during peak sunlight hours. Regular eye exams are also essential for early detection and monitoring of any changes in your eyes, including the appearance of new or changing conjunctival nevi. The prognosis for conjunctival nevi is generally excellent. Most nevi are benign and pose no threat to vision or overall health. However, it's important to remember that there's a small risk of malignant transformation. Therefore, regular monitoring by an eye care professional is essential. Recent research is focused on developing better methods for distinguishing between benign nevi and malignant melanomas, as well as on improving treatment techniques. Advanced imaging techniques, such as optical coherence tomography, are being used to visualize the structures of the conjunctiva in greater detail. Additionally, researchers are exploring the role of genetics and molecular markers in the development of conjunctival nevi and melanomas. Thanks for watching, and remember to prioritize your eye health with regular check-ups.